And welcome back. Now, producer Vania and cameraperson Mpho Masela visited Eurolab Oncology Laboratory in Midrand in Gauteng this week. Now, Eurolab is the largest generic oncology company in South Africa and says thanks to their world-class technology and methods of mixing cancer medications, patients will benefit from reduced waiting times and also receive quality and improved medicines.
We're at Eurolab, which is a laboratory in Midrand in Gauteng, which specializes in sterile oncology medicines, and it's the first of its kind in South Africa. Eurolab says it is using state-of-the-art methods to give South Africans the most sterile oncology medicines.
The equipment is called scan RDI. It's used for sterility testing. In the pharmaceutical industry, it's required that before a product can be released out into the market, it has to be tested for sterility, specifically medicine that is intravenously administered into patients. That's what it is.
What does RDI stand for?
RDI stands for Rapid Detection Identification System.
Fokotsi says that the new methods saves time.
In the pharmaceutical industry, if you use a traditional method, which is called the sterility testing, found in the USP and the BP, these are pharmacopoeias, it generally takes 14 days. Reason being is you use enrichment broth, or in layman's terms, medium that helps to resuscitate these microbes. What happens in the scan RDI is you cut down the timeline to 4 hours.
Gabby Seaman, the chairman and co-founder of Eurolab, says that this laboratory is bringing first-world oncology treatment to our shores.
Our mission is to bring first-world treatments to South Africa. We've done it with the gamma knife. We're just busy launching a liquid biopsy that will be able to determine if there's treatment failures, with a simple blood test, what treatments would work, etc., etc. So that's something for the future. And then, most importantly, we've just launched the ASU, an aseptic unit, which is first GMP compounding unit in the world that mixes oncology medicines.
Seaman says that South African cancer patients in the public health sector is not getting the treatment they need.
We've got 12 hospitals, government hospitals, treating oncology. There's 4 provinces that haven't even got oncology treatment hospitals. The ASU will be able to bring oncology treatments into rural areas. 2,000 clinics, we believe, primary clinics will be able to send oncology treatments there. All that's needed is a nurse and a fridge, and basically that's it.
He categorically states that the lack of accessibility to oncology treatment is due to apartheid.
Public sector is basically down to apartheid. The majority of the hospitals were built for the minority, 4 or 5 million people, and our other people that weren't white had to share hospitals that were inferior. Although Baragwanath was one of the top in the world, we just have had a population explosion in those hospitals, so to talk, and we couldn't cope with it. So it's no fault of the government, I believe, that we are where we are. It's a fault of the past.
According to Gavin Steele, the CEO of Eurolab, the new technology used in this laboratory will help reduce the discomfort that comes along with cancer treatment.
How this technology is going to work for the patient is that we will mix the product centrally over here in Johannesburg. The product will be stable for a period of time and can be kept on the shelf.
Steele says oncology treatment in South Africa is very expensive.
So as mentioned, vial for vial or unit by unit, oncology medicines are the most expensive that is used both in the public and the private sector. And so by our processes, what we can do is save between 8 and sometimes as much as 12% for the patient or the government who's funding the treatment.
According to Steele, the death rate due to cancer can be reduced in rural areas if they receive the same treatment as their counterparts in urban areas.
A paper was published from the United States that shows that rural patients in clinical trials, in other words, where everything is done perfectly to test the medicine, rural patients will achieve the same outcome as urban patients.
Eurolab says its vision is to make sterile oncology medicine available to all patients across the country. Vania for SABC News in Johannesburg.